From the Bull and Bear in New York's legendary Waldorf Astoria Hotel, this is Happy Hour.
All right, Senate Majority Leader Harry Reid is waiting to hear from the Congressional Budget Office to find out the cost estimate of his proposed health care bill so he can begin the debate on the floor as early as this Friday. The Senate needs 60 votes to pass their version. They will not adopt the $1 trillion bill, which barely passed the House earlier this month. The big question is, once House and Senate can agree and can actually agree on a bill, how effective will this legislation be when it comes to your health care? Retired vet Daniel Hunger was denied care under the government plan and is here to tell us about his struggle. Also, Dr. David Cloth, former president of the American Society of Interventional Pain Physicians, says David's story is an example of how government will ration care if they have control over it. Doctor, I want to get to you in 1 second. First, Sergeant, tell us exactly what went on. You were receiving care for pain, and then the government pulled it. Tell us about it.
Correct. I had 2 back surgeries before I retired, and dealing with the aftermath of that with the scar tissue and things like that, you know, it's created more problems on its own. I'd been receiving several treatments from a pain physician in my area, and they were becoming very effective. And just recently, about a week ago, I was advised that they were no longer going to be able to provide that care for me because my TRICARE had dropped it.
Now, TRICARE is the military version of, I guess, Medicare. That would be military complete care for the vet, the family, and siblings?
TRICARE is really health insurance for active military personnel, retired military personnel like Dan, and their families, also other people who have done full service, and also National Guard.
Doc, why would they pull it? Out of the blue, first of all, did they give them notice? And second of all, why would they do that?
We found this policy indirectly. We found a lot of people being denied for this treatment, and our doctors reported this to our National Society. And when we looked into it, they actually had a written policy they had put out to deny this specific treatment. This is a standard treatment we do every day. It's covered by Medicare, and it's really just the start of rationing. This is probably an overreaction to an OIG study that came out in September of '08, and it showed some abuse. And instead of trying to deal with it properly and working with the doctors and the National Medical Societies, this is what they did.
I want to get back to Sergeant in a second, but did you say it's covered by Medicare?
This is a covered procedure by Medicare.
So if you're 65, you're covered. If you're a Medicaid recipient, you're covered as well?
Yep. When he turns 65, he can get it again.
But he's a military vet and he can't get it.
Correct. And it's not just that treatment. There's a number of treatments that he wouldn't be able to get that would help his pain. Basic headache treatments, treatment for, say, a disc herniation in the middle of your back.
Sergeant, let me ask you this. So in lieu of this treatment, would you be taking prescription drugs?
I do take several medications continually for the pain, but these treatments have helped to reduce the amount of medication that I've had to take. And I fear if they don't come up with an alternative or get this returned as a method of care that I can receive, that I'll be back taking more prescription medications.
And so, Doc, is this the beginning of a bigger rationing plan that maybe the administration might be putting on? And why vets? Why military personnel?
You know,
first?
it's bizarre because they just passed a bill to increase pain management care for vets at VA hospitals, and then TRICARE does this. It's really confusing to us. We're trying to work with Congress and CMS and various parties to try to get this corrected, but it is a problem, and Dan's right. If he doesn't take these injections, these treatments, he'll end up on a lot more medications, which will cognitively affect him, and it's not what he wants.
So can he, or let me ask either one of you, can he go to a VA hospital, walk in there and get the treatment?
I don't believe so, but you...
I don't believe so. I believe it's the treatment itself that has been dropped, but I don't know if they even provide it at the VA centers.
All right, so is there an indication that there may be, you know, a further expanding, a further reach into what they provide on TRICARE?
Absolutely. I mean, and again, TRICARE, he's part of TRICARE North, which covers about 2.5 million people. TRICARE Total covers over 9 million Americans. And the company that runs TRICARE actually covers about 30 or 40 million Americans. They do a lot of Medicare intermediaries and other. So if this expands, it can really rapidly progress.
It's just the beginning. All right, that's Dr. David Cloth, the ASIPP board member. And and Daniel Hullinger, Air Force First Sergeant, retired. Guys, thank you very much. Real quick, I got to read this. TRICARE, we contacted them all day. They sent the statement very long, but let me read a piece of it here. It says TMA conducted an extensive review of the published literature on radio frequency ablation for the treatment of chronic spinal pain. TMA determined there was insufficient reliable evidence to establish that radio frequency ablation for the treatment of chronic spinal pain is safe, effective, and comparable to conventional treatment. Proven. All right. There you have it. A little bit of rationing. All right, on tap. I'm smoking this place out with some Red Hot.